Members, it's the appointed time. We have a quorum. I call to order the meeting. Agenda item number 1. Information papers issued since the last meeting. After the last meeting, the Secretariat has issued 3 papers to members. Please take note of them. The details have been listed on the agenda. Agenda item number 2. Items for discussion at the next meeting. The next meeting of the panel will be convened on the 14th of March, Friday at 10:45. We'll discuss 2 items. 1, the development of Chinese medicine, and 2, Hong Kong U Medicine Campus Redevelopment Project, construction of clinical training and amenity center. Any views? Ms. Rebecca Chen. Thank you, Chairman. We're going to discuss 2 items at the next meeting. I'd like to express my views. I'd like to ask about the communication between the Secretariat and the administration. When will the administration have to submit the papers? Well, we'll request the administration to submit papers as soon as possible. Earlier on, at least 5 days papers had to be submitted to the Secretariat, in some cases before 2 days in advance. Well, I think 3 days in advance, this is the minimum. If time is sufficient, 5 days in advance papers should be submitted. For an item to be discussed today, papers were only submitted to the Secretariat at 7 or 8 p.m. yesterday. These 2 items are very important. When the papers are submitted late, it will affect our preparation. Well, it's been less than 24 hours, so I'd like to express my views on the time of paper submission. Next, Ms. Elizabeth Kwon. Thank you, Chairman. Thank you for allowing me to speak. I'd like to discuss the topic HPV vaccination as one of the discussion items. We have been discussing this for a long time. There should be free vaccination of HPV vaccines. Right now, 180,000 vaccines have been purchased for 50,000 female students in Hong Kong. Only 300 or so secondary schools have indicated their participation in the scheme. Some schools haven't yet replied. Right now, the vaccination figures only stand at 3,700. The figures are disappointing. So I'd like to make my point that the Education Bureau and the DH should come to the Council so that we can discuss how to boost the uptake of the vaccines. Thank you. Ms. Connie Lam. Thank you, Chairman. I'd like to write on Ms. Rebecca Chan's point. This is the first meeting of the panel on health services. We have 2 items today. They are very important. The second item in relation to the clusters of the HA. At 7:43 last night, I learned from the media that the cluster adjustment had to do with the development of the Northern Metropolis. We didn't have enough time to go through the papers, so how can we discuss these items today? Staff members in the cluster also said that there's not sufficient time to tap the pulse of the community, and this is indeed disappointing. Professor Priscilla Leung. Am I coming through? Thank you. Thank you, Chairman. I sent a letter to discuss the manpower shortage of the Hong Kong Children's Hospital. I thought that it would be discussed at the next meeting, but I learned the Chairman allowed me to discuss this item, which is close to the heart of society, to be discussed in the Second discussion item. I'm grateful to Chairman. There are many items waiting to be discussed, and Chairman, you have responded to calls in society. While it will be discussed under the fourth agenda item, it will not be a standalone discussion item. All right. If there are no other views to be expressed by members, let's move on to the next agenda item. The administration made suggestions on revising some items on the list of outstanding items for discussion. The details are in the introductions to the items on the list. If members have no objection, the list will be revised as suggested by the administration. Any views? No. Agenda item number 3. Loan arrangement for CUHK Medical Center. Deputy Chair, please take the seat next to me. All right, let's invite the administration to join us. We invite non-members of the panel to join the discussion today as well. This item has to do with a funding proposal in accordance with Rule 83A of the Rules of Procedure. If members have direct or indirect pecuniary interest in a discussion item, please declare the nature of the relevant interest before you speak. We have with us Professor Lo Chung-Mao, Secretary for Health, Mr. Thomas Chan, Permanent Secretary for Health, Mr. Sam Hui, Deputy Secretary for Health, Mr. Ronald Chang, Principal Assistant Secretary for Health. We also have from the Chinese University of Hong Kong, Professor John Chai, Professor Dennis Lo, Vice Chancellor of CU, Professor Philip Chiu, Dean of Faculty of Medicine from the CUHK, Dr. Li Chen, Chairman of the Board of Directors of the CUHK Medical Center, and Dr. Feng Hong, Executive Director and CEO of the CUHK Medical Center. In a moment, the administration will take us through the papers. If members would like to speak on this agenda item, please press the button to request to speak. Please take us through the paper. Thank you. Professor Lo. Thank you, Chairman. I'm going to speak on the loan arrangement for CUHK Medical Center. They are asking for the extension of the repayment period for another 3 years, and it will have to be approved by the Finance Committee. CUHK and the CUHK-MC are with us as well. They will report on the latest situation of the CUHK-MC. In 2014, CUHK proposed to develop a non-profit-making private teaching hospital. In April 2015, FC approved the provision of a government loan to CUHK Medical Center Limited, which is a wholly owned subsidiary of CUHK. The loan amount approved is $4,033 million. Starting from 2023, CUHK-MC will have to be repaid the loan for 10 years, including the principal of $403 million. And the interest will be calculated based on the interest rate in the exchange fund. CUHK-MC commenced operation in September 2021. It was in the middle of the COVID-19 epidemic. If CUHK-MC was to repay the loan, it would not be able to sustain its operation. That's why CUHK-MC proposed a 5-year extension of its repayment to the government. After discussion in 2023, on the 24th of February, FC approved a repayment schedule of 2+3. The repayment was allowed to be put back to the 19th of March 2025. Then, approval was to be sought from the FC for the remaining 3-year extension. CUHK-MC will have to provide medical services in lieu of the interest payable. The administration undertook to report on the latest operation situation of CUHK-MC. Last year, we already made the first report to the Council. After 3 years or so of actual operation experience, the financial position has been improving, but then the extent is not as good as projected by the Independent Financial Advisor, IFA. It shows that CUHK-MC still has room of improvement in relation to the service provision and financial position. Obviously, the financial position of the CUHK-MC would not allow it to repay the loan to the government. So we'll have to seek approval from the Finance Committee in relation to the loan extension repayment. Subject to the approval of the FC, we will enhance monitoring on the CUHK-MC so that the medical center will cut costs and open up new income streams. In 2024, CUHK-MC met the target by providing packaged medical services. The rate was as high as 51% of meeting the target. At least 50% of the inpatient needs to be provided through packaged charging services. Starting from the third year of service provision, a total of 15,253 inpatient services were provided and 5,720 surgeries were performed. In 2024, CUHK-MC should provide public medical services equivalent to 5,698 beds. In the end, CUHK-MC provided services equivalent to 6,866 hospital beds. That means CUHK-MC exceeded the target by 20%. This shows that the packaged medical services provision allowed the CUHK-MC to provide affordable, transparent, and predictable prices. The administration will continue to keep a close watch on the operation of the CUHK-MC. There will also be annual reports to the Council in relation to the CUHK-MC operation situation. I now invite Professor John Chai and Dr. Feng Hong to speak in brief, and then we will take questions from the floor. Professor Chai. Thank you, Chairman. Thank you, Chairman. Good morning, Chairman and members. I thank members of the public for the support for the CUHK-MC. Setting up CUHK-MC is one of the important undertakings of the CUHK in relation to serving the public. The purpose is to set up a teaching hospital and provide packaged medical services. It aims to provide affordable and transparent medical services to the public. It will also be used as a teaching hospital. This will help reduce the pressure on the public healthcare system. CUHK hasn't forgotten the target of, the purpose of setting up CUHK-MC. It aims to serve the public. The service model needs to be successful in order to benefit members of the public. We have accumulated 3 years of actual operation experience. The operational model is commercially viable. From the papers provided by the administration, we can see that the income of the CUHK-MC has been increasing, but meanwhile, the costs have been going up as well. It is clear that the cash flow of the CUHK-MC will not be able to allow the CUHK-MC to repay the loan. That's exactly why we have to apply for a loan extension. CUHK supports the development of the CUHK-MC. Together, we will address the challenges in relation to insufficient cash flow. Subject to approval of the loan extension, We aim to cut costs and open up new income streams to improve the financial situation of the medical center. We will also improve its business portfolio. We will maintain a close dialogue on strengthening the governance structure. CU will closely monitor the operation and financial situation of the medical center to ensure that its operation is good. At last meeting of the council, we have appointed Professor Dennis Low to take over the position of the chairman of the board of directors of the CUHKMC. This highlights our great determination. We seek approval of the 3-year extension of the loan repayment period. We want to seek approval from the Legislative Council so that the medical center will continue to fulfill its service obligation. Thank you.
Dr. Feng Hong, thank you, Chair. And I'm also thankful for the previous speeches. Last March, we have submitted our previous report to Legislative Council. Since then, our operation continued to increase in a stable manner. In the first half of 2024, our total income is up to 12.3 billion, compared with the previous year, which is just 9.54. It is an increase of 30%, and it is up to the total income of our expectation. Before reducing tax depreciation, and we are also doing better in this regard. From 173 million, we have reduced to 77 million, and it is a decrease of 55%. Such improvement in the financial statement is because our rigorous cost control measures, so that our fixed income percentage continue to decrease. CHKMC in last November, that is 20 months after the reopening since COVID-19, we have achieved a single month of break-even. And this is an encouraging result. In terms of cash flow, reducing all the service expenses in order to materialize our contract, it is up to 185 million. Compare the expectation of the IFA, it is an increase of 33 million. We are confident that the operation of CHKMC will continue to grow. Our previous performance has also proved the viability of our business model. It is a correct direction. And the actual inpatient bed number is up to 300. According to the requirement of the lease, we will continue to put into practice all the other beds. Before October 2027, we would have a total of 510 inpatient beds. In the coming few years, we believe that we will have a very tight cash flow in order to repay all our loan. We will continue to seek viable financial arrangement in order to reduce pressure in this regard. Of course, as the chair mentioned, we will continue to increase our income while cutting our cost. Most importantly, CHKMC has increased all the standards that is required by the government to materialize our pledge. Since the 31st of September 2024, we have offered services of 51.2%, which is more than our promise, which is 50%. As of the 2023, September 1st, we are able to offer 12,583 beds, which is 50% of the total, and the surgery in percent numbers is up to 8,600, which is up to 151%. In 2024, we have offered 6,866 patient beds number, which is up to 120% of our annual goal. CHKMC has already announced 819 packaged services. It is the acceptance of the market to this kind of service is gradually increasing. It is very important for us to maintain transparency and offer stable services. As the insurance sector continue to make use of these packaged services, the citizens will be able to enjoy expectable private medical services, reducing the long-term stress of the public health sector. We have the total number of 13 members which has expressed their intention to speak. Okay, we have the total of 14 members who would like to speak. 4 minutes for each member. After our first member has finished speaking, we will draw the line. Let's read the names of members. Tan Pui-Lan, Tan Yue-hong, Chen Wing-Kwang, Stanley Lee, Lam So-wei, Chen Hoi-yan, Peter Douglas Kwun, Edward Lang, Tan Ka-Piu, Sarah Lee, Priscilla Lang, Michael Tan, Tammy Chung, and myself, David Lam. 4 minutes for each person. Question and answers include. Thank you, Chair. Personally speaking, I have high expectations towards the business model and the performance of CHKMC, especially the packaged services. I believe that it will be very helpful in enhancing the transparency of the private health sector. It is a role model. Therefore, I very much look forward to seeing the success of CHKMC in this regard. As I can see, the package service, well, according to the information, actually it has close ties with the support of the insurance sector. Since we have aging population, more and more people are concerned about their future healthcare needs. Many individual healthcare insurance is provided for them to receive speedy care in the private sector. Speaking of that, I would like to see how CHKMC is collaborating with the insurance sector. I can see that you are already developing a lot together with them. But in terms of future services and products, will there be even more discussion in the future so that the operating income of CHKMC will be more stable in long run? It will be very helpful to the financial standing of CHKMC. Or did you encounter any difficulties? I can see that you are working with a number of companies already, but there are still many more in the market. Can you give us some details in this regard? Speaking of your finance, I see that in your budget, although you said that there will be a positive cash flow by 2029, but the positive cash flow in 28-29 is still not enough for you to repay the interest and principal. We have to wait until 2031. That will be a time when you have a private cash flow in order to repay your loan. So what are your considerations? In the projected cash flow, your operating income and the operating expenses has remained the same in terms of the proportion, especially after 2031. Both the income and expenses has maintained at 5%. But if you're in the business sector, you know that it is certainly for us to have a higher operating income than your operating expenses so that you can accumulate funds for future development. So if the growth ratio remained the same, would you see any problems in terms of cash flow accumulation, or you are just being conservative? Professor Low, I would like to direct the questions about package services to Dr. Feng Hong. Thank you for your questions, Chen. We are working with a major insurance company. There are some contracts for direct payment. Therefore, they can be engaged directly with the package price. But not all insurance companies accept that. Many of them still rely on a conventional payment method, and they are inclined to charge by service item. Step by step, we hope to introduce it to even more insurance companies. We hope that they will accept. Second, the coverage of the package services, especially the surgical items. I think as we accumulate more experience, we can increase in an incremental manner. This January, we have included some traditional cardiovascular surgery, that is the stent surgery. We need to accumulate more experience in order to provide that kind of services. The third area for improvement is our pricing. Because at the beginning, you do not have any market information. However, as we interact even more with the insurance company, we have more pricing information from the market. So it is possible for us to set a more reasonable price. We will have better control over that so that the general public will be able to afford the medical services that we provide. Well, we can allow for some brief supplement. Yes, I will talk about the financial standing. The figures at the moment are projected figures. Compared with our previous projection, in recent days, we truly see that there will be an extension in terms of breaking even and the repayment of loans. But there are a lot of assumptions in the projected figures. As mentioned, there will be a growth ratio year by year. Theoretically speaking, as we increase our services, our fixed expenses shall be split. And the overall increase of cost will not go side by side with the income. We expect the two curves to cross path. We hope that as we enhance our efficiency as well as our amount of services, the overall increase of cost will not be in the same ratio of the increase of expenses. Thank you, Chair. CHKMC is a non-profit private teaching hospital. In terms of promoting the research and teaching in the healthcare sector and facilitating the collaboration of both the private and public sector, it is truly a very important institution, and it has just started. And as it started, it is in phase of the COVID-19. It is just a year or two after the pandemic, so it is still an early stage of our development. It is understandable for us to see some extension. I agree to extend the repayment of loans for 3 years, but I have two areas of concerns. First, as an operating entity, it surely needs to increase income and to control your expenses. In 2024-25, your business strategy covers 6 major areas, and I can see that you need to increase your healthcare income in these 6 areas. So how exactly are you going to materialize all these strategies? How much income can it generate? It is not being demonstrated here. As a teaching hospital, we do not target at making money in every single area. We are offering some comprehensive services. However, approximately how much income can you generate in each sector? You need to be able to estimate that. What are some key areas of services? I hope there will be some explanation. Second, about controlling our expenses. Basically, it's not being explained. You just tell me that you're going to control your cost. Well, can you at least show me some major measures? This is my first area of concerns. Second, as an operating entity, we need to audit the management. Are they operating well? If they are operating well, there should be some reward, or if they are not doing a good job, then there needs to be some following of actions.
院方同埋校
Secretary, I'd like to give the floor to the CUHK and the CUHK-MC to respond to members. Well, yes, there are 6 business strategies. At present, some 40% of the patients are insured. They have taken out their own medical insurance policies. Some 50% of the patients are paying the medical services out of their own pocket. There are also oncology patients. Our focus is on promoting packaged and non-packaged medical services. We want to use packaged medical services as the focus. We also want to promote medical services with insurance policies for self-financing patients. They aren't covered by traditional healthcare policies, insurance policies. So we need to enable them to be able to afford private medical services. Cross-boundary patients are also involved. They make up a minority of all the patients, but we still include them in the picture. We want a complete picture in relation to cutting costs. With the capacity and the number of passengers increasing, the ratio of fixed costs is on the decline. That is because we have sufficient patient capacity to share the costs. Staff on costs are another major element. Our current practice is to control the number of medical staff members. We only take on staff members when we find it necessary. There are 2 elements of staff costs. One, for medical healthcare professionals, say allied healthcare professionals and nurses. We follow the pay scale of the hospital authority. We need to compete with the HA. We cannot afford to lag behind the market trend if we want to compete for manpower. We make adjustments to wages considering the local situation, but still, our major policy is to control the headcount. 4 staff members to 1 hospital bed, and that is our general direction. And this is a very important element in cost control. Thank you. Anything else to add, Professor Chai? In relation to governance, I'd like to invite Professor Dennis Low to give you more information. In relation to clinical governance, CUHK wants to enhance collaboration with the CUHK-MC. That's why recently we have appointed a number of experienced clinical professors to the board of directors of the CUHK-MC. They are orthopedic experts, ophthalmic experts, and cancer experts. In terms of physiotherapy, we enjoy world-class reputation. So we think we may be able to make further enhancements in these areas. Thank you, Professor Chairman Kong. Thank you, Chairman. I need to declare I'm a visiting professor of Chinese medicine at the CUHK. According to the latest projections of the CUHK-MC, even if the FC approved the 3-year loan repayment period in 2027 to 28, the cash flow balance will only stand at $183 million. So we'll not be able to repay the loan at $400 million. So I'd like to know how the CUHK-MC will address the cash flow gap. I don't want to see the medical center coming back to the council 3 years later to apply for yet another round of repayment period. In paragraph 43, CUHK-MC will explore further proposals. I'd like to know whether the CUHK can give us more information about its financing proposals. CUHK-MC is convenient when it comes to transport. It also boasts many experts in relation to Chinese medicine or other clinical professors. How can you promote the fact that CUHK-MC provides high-quality medical services so that more patients will come to the medical center to seek medical treatments? If the operational situation doesn't improve remarkably, and if CUHK still fails to repay the loans after 3 years, what plans do you have? The cash flow situations aren't as good as the projections made by the IFA. According to NS1, doctor costs and staff costs are 63 million higher than the projections. I'd like to know why the actual situation or the actual figures are higher than the projections. But I have 1 minute 30 seconds to respond to 5 questions. Most of these questions should be taken by the CUHK and the medical center. I will take the question in relation to loan repayment. If CUHK-MC fails to repay the loan according to the contract, it is clearly stipulated in the contract that the interest rate will go up by 3%. And if it still fails to repay the loan, in the worst case scenario, the government will take back the medical center, including the site and all the buildings or structures erected thereon. We don't want to see this situation. We recognize the important role of the medical center. We recognize its progress and operation as well. We still have 3 years ahead. The projections may not be ideal, but we can still make improvements. We may still be able to narrow the difference. In relation to financing, CUHK is still considering different financing options. Medical Center, which one would take the question? Thank you. Briefly on cost control, we only mentioned one aspect, that is doctor costs and staff costs. Doctor costs are more important. They account for a higher percentage, accounting for 41% of the profit loss statement. At present, it stands at 44%. We have had internal discussions on the reasons behind it. Experienced doctors and university professors provide medical services. This is important to ensuring the quality of the medical services. We need to prevent complications after surgeries. We may need experienced doctors to ensure the quality of the services provided. That's why doctor costs account for a higher percentage. That's why it's higher than the projected 41%. Regarding staff costs, for non-doctor staff members, we have been controlling the cost. We expect that the ratio will decrease following an increase in the number of patients. Thank you, member, for your question. There's a cash balance gap. In our projections, this is true. As the Secretary said, we still have to work hard in the coming few years. We need to improve governance and operation. The service mode is recognized by the medical center and the university. This is actually a new model of operation. It is transparent. To a certain extent, it provides support to different medical services in the public healthcare system. This is a new model, and we are still learning every day. We'll make improvements. Another piece of information I'd like to share with you. Since the start of the medical center, about $3 billion have been injected to the medical center. Some of the injections were donated by the community. We do have the responsibility for the operation of the CUHKMC. We will consider different financing options. I will keep the time limit strictly, as there are still 14 members who haven't yet spoken. So probably the administration or CUHK may have to provide written replies. We have already drawn a line. Next, Mr. Stanley Lee. Thank you, Chairman. Thank you, President, for coming to the Council. Your President didn't come to the Council, so thank you. In the minutes of the meeting 2 years earlier, the CUHKMC said that they were so confident about their future. But 2 years have passed. Despite growth, there is still a distance. There's still some way from breaking even. The medical center needs to know that they have to control costs and create new income streams. Just now we've heard some measures. Despite some plans in the pipeline, I'd like the medical center to tell us know how you will further create new income streams. In Thailand, the tourist industry has been hit hard because of the scams. Many people in Hong Kong used to go to Thailand for medical checks. Has CUHK considered organizing such tours to provide medical checkups? I've been to the CUHK Medical Center to seek medical treatment. It was in the middle of a public holiday. The wait at A&E department in public hospitals is as long as 6 to 7 hours. Do we need to ramp up publicity? CUHKMC is situated in Sha Tin, and it's my constituency. Not all residents of Sha Tin know that there's CUHKMC in Sha Tin. You may need to distribute flyers. Just like electioneering, I distributed flyers in the streets as well. We need to take exceptional measures in exceptional times. So I hope CUHK and CUHKMC will consider how to cut costs and create new income streams.
Thank you, Chair. Speaking of increasing income and cutting costs, well, in terms of medical checkup, I know that we need to promote it in a very active manner. I would like to defer it to Dr. Fong Hong. Well, body check is a very important income. Well, locally speaking, there are still a lot of corporates that offer medical checkup, especially to the senior members, and we cover a lot of them, and we have already signed a lot of service contracts with them. As for mainland, we are actually quite popular on Little Red Book. There are a lot of automated promotion on that platform. On Baidu and WeChat, we are also establishing our corporate channel. Our information can be directly dispatched in mainland China. There are also some agencies that organize to provide body check services. Actually, gynecology is one of the most rapidly developed sector. Well, we are working together with many mainland China clients, especially those clients who come to Hong Kong. Our major promotion platform relies on the social media. As mentioned, we will make use of Baidu, WeChat, Facebook, Instagram. These are all some platforms that we are actively promoting our services. We see some positive results. As for the A&E Center, well, our apologies. At the early stage, our procedures needs to be improved. However, during CNY, basically most patients can be able to complete all procedures within 3 hours. Thank you. If you have any supplementary response, please submit it in written form. Next. Ms. Lam So Wai. CHKMC is applying for extension of repayment. Well, previously they gave the reasons as the impact of COVID, but now it's another couple of years. And now you said that you will introduce some professors to develop your services and to introduce package services. However, in the last couple of years, do you think that the operating strategies is rather ineffective? I lack confidence in you. I'm not sure if your new businesses can cover your cost. Although the president said that there will be some financing in 2028 and 2033, you are still in deficit. Which financial institute will offer you financing plans? Even if you succeed, if you continue to be in the red, are you going to come back and apply for another extension? If it is going to be such a vicious cycle, as Professor Low mentioned, can we plan ahead to take back the hospital? We have heavy burden in the public healthcare sector. If you are truly unable to repay your loan, shall we provide you with subsidies so that we can triage some patients to CHKMC, including those middle-class patients? And it is also reducing the expenses of the public healthcare sector. It is also one mechanism for you to repay the loan. From the news, I know that there are some KOL who gave birth at CHKMC. For the OB and gynecology sector, there are 35% of increase there. Is it possible for you to organize some featured specialist, including giving birth or IVF, etc.? You also mentioned that 50% are some self-financed oncology patients. You have a lot of R&D experts from CHK. Is it possible for you to make money out of that? While you are applying for an extension of repayment, I hope that you can also explain to us about measures of increasing your income so that we can have more confidence in agreeing to your application. So will you focus on some profit-making sector? Any strategies? Let me respond to the first part of your question. About the extension of repayment, in 2023, we are asking for a 5-year of extension, we have never thought that 2 years will be enough. We just propose that it shall be a 2 plus 3 year plan. So it is not a second coming of application. We already planned to come back to the Legislative Council now, back then. CHKMC is already offering services to the public sector. In the service contract, they are offering some outpatient clinic services and also some ambulatory care services for HA. The interest of the repayment period is being covered in such ways. In my initial speech, the services that they provided is over 6,800. Which is 20% more than what they have pledged, including outpatient clinic, imaging, inpatient services, etc. It is a sum of the total inpatient beds number. So it is truly providing support to the public healthcare sector. For the rest, I would defer to Dr. Feng Hong. According to the papers, under the leadership of the board, we have already formulated 6 development strategies for increasing income. Our collaboration with the insurance sector and the referral cases from them is one important measure because it's very important. Just now we have mentioned about a lot of self-financed patients, especially the oncology patient. It is a reflection of the citizens' needs. Although they are not covered by insurance, they would prefer private healthcare sector. So it is a major part. There are also other specialists. Apart from oncology, we also have the cardiovascular, the gynecology, ONT, and sports medicines, etc. These are all our strengths. We have quite a huge number of patients in each of these specialty, and they continue to increase. And surely we will continue to enhance our quality of services as well as our quantity. We will also strengthen our referral mechanism so that the volume of cases can continue to grow. Ms. Rebecca Chen, thank you, Chair. I support the 2 plus 3 extension period of repayment of loan. CHKMC is a very important indicator to the reform of our healthcare sector, especially the packaged services. It's surely worth supporting. However, as they start operating, the whole economy is far from fair. But there are still questions that I would like to ask so that I can support even more. Looking at your finances, by 2027, you will start to generate profit. However, in terms of the operation of beds, it is also the same year as 2027 that you will be able to fully utilize all your inpatient beds. If you're able to do it sooner, the income will also be greater. As we discussed 2 plus 3 plan previously, you said that you are lack of staff. Therefore, although you already have those space, you are unable to admit patients. Can you resolve this problem early on so that you can put into use more beds because you have the quality, you have overseas patients, but you are unable to operate that many beds in order to make money? My first question is, are you able to operate fully your inpatient beds within this year? Second, the reason I support you is because you have a very good university that is CHK as your support. How much more can CHK support the MC, including some exclusive surgery, exclusive types of body checks? A few years back, for the gynecology, Professor Low would surely be able to find out the situation of the fetus through those checkups. So are there any exclusive services that can be supported by CHK so that the MC will be able to expand its market? I mean, not only the local market, but also the overseas market. Since they are exclusive, you can also charge them higher. Well, it is good for us to operate more inpatient beds, but it involves cost as well as the deployment of staff. We have to ensure that the usage is high before we put those inpatient beds into use. So it has to be matched. I think Dr. Feng Hong needs to look into the percentage of usage. Has it been saturated? If that is true, then surely we should put into use more beds so that we can receive more patients. I support what Professor Low has mentioned. Previously, we are short of staff, so our development is limited. On the other hand, the utilization rates also needs to be ensured. Otherwise, if we are opening more beds, they will be going into waste. So we have to monitor the number of patients as well as our income when doing this. Taking this year as an example, later this year, we will start a ward for cardiovascular patients because they are high in proportion. This is how we ensure quality and to meet their needs. As for now, the timeline of putting into use our beds is largely in line with what we pledge with the government. It can be flexible, but we are not just talking about inpatient beds, and also the OR, the other areas are all important. So how can we better arrange our outpatient clinic hours? We are closely monitoring the needs in all these areas so that we can increase our service volume. The President, thank you. Surely we will strengthen the collaboration between CHK and the MC so that we can put into place more innovative measures, including the non-invasive DNA test. Many staff of CHK are already making use of such tests, and we know that artificial intelligence is very important. We are making use of AI colotectomy scope in order to find out if there is any cancer cells. Third, there are also some new techniques making use of ultrasound technology to kill cancer cells. We will introduce all these technology into the MC. Next, Mr. Peter Douglas Kwun. I do support the application of CHK-MC, but I do have some questions to be clarified. On page 6 of the papers, I can see that there are already 79 numbers of professors from CHK who are at work. So in the future, can we increase the number of professors? Can they spend more hours in the MC? Second, the visiting doctors. I have heard that some visiting doctors find that the CHK MC is rather remote. You know, visiting doctors can generate a lot of income for a private hospital. Are there any measures for you to attract them? Some are in the Hong Kong Island hospitals or those in the Kowloon district. Can you attract them to hospitals in the New Territories as well? Next, talking about the packaged charging services. Now it is 50%. In the future, you hope that it will be 60 or even 70%. As far as I understand, it is surely something positive, but the profit margin is relatively low. Will it be related to your capability in repaying the loans? Can you please stipulate it, because you put so much emphasis in this area? Simply put, it caused you to make a limited profit. As explained by the MC, you want to ensure that it can be covered. You want to be able to cover the unexpected complications. Therefore, you need to hire some more senior doctors. Can you please explain it to the public, because it will help us understand about your ability in repaying the loans? Well, because if you have difficulties in making money, therefore you have limited capability in repayment. Normally a hospital do not rely on package services in making money. You should rely on some more general procedures. Can you spare some time in order to explain to us?
關於個中大
Secretary, thank you. In relation to the questions on professors and visiting doctors, I will defer to Dr. Fong. I'd like to speak on the packages. Packaged medical services cover low-risk medical procedures, say surgeries. It doesn't mean that the medical center will stand to lose. If the pricing is right, then there will be a win-win situation because unnecessary checkups will be dispensed with. Overall efficiency will be enhanced. On average, the costs will be reduced for all patients. That's how the medical center can enhance its revenue. Dr. Fong, well, I will ask Professor Chu to reply. Professor, right now we have 79 professors working at CUHKMC. They are providing medical services. 99% of the professors have the admission right to carry out clinical procedures. Professors' working hours in the private medical sector is limited. They can only devote 20% of their time in the provision of private medical service provision. We will introduce advanced technologies to enhance the medical services provided by the CUHKMC. With the collaboration of the CUHK and the medical center, we have set up a clinic of CUHK professors. We aim to give better play to our role. More and more doctors find that we have a convenient location. We have some 500 visiting doctors. When they provide services at the medical center, they don't charge packaged charging. I agree that packaged medical services reduce loss. That is, I mean unnecessary checkups, drugs, and so on. This is very important. The price level will be more reasonable as a result. We want to make the pricing level reasonable. At least the insurance sector will find the price level reasonable, acceptable. This is the greatest protection offered to the public. Mr. Chen Kim-por. Thank you, Chairman. In paragraph 36 of the paper, both the government and CUHK look forward to the success of the service model in providing affordable, transparent, and quality private healthcare services for the benefit of the public, especially the middle class. Well, this is not just the wish of the government and CUHK. The insurance sector also looks forward to it. Cost control of the medical center is spiraling out of control. When one reaches the age of 60, one will not be able to take out healthcare policies, insurance policies. The government is working on the transparent price level of medical services. Through packaged charging services and a competition model with other private hospitals, we need to ensure the medical services provided are reasonable in relation to the price. So I agree with the repayment extension of loan for 3 years. Dr. Feng has provided a lot of information. He's very active in relation to looking for insurance companies. Some 70% to 80% of the medical expenses are covered by insurance policies. Seven hospitals are improving the situation. I'll see how I will liaise with insurance companies to encourage more agents to promote these to clients. There were 100,000 or so agents in Hong Kong. Excluding those working in banks, we have some 50,000 to 60,000 agents. We need to promote CUHK-MC services to the public. I use medical center services as well. The price is reasonable, the facilities are good, so we should promote it. Probably a particular insurance company only compensates 80% of the medical expenses to clients. I support this proposal. And I want to see more reasonable price levels charged by private hospitals. There's still a lot of room for improvement in relation to AI. We need to provide more financial assistance to the CUHK-MC. We look forward to its success. These are my comments. Secretary, any brief response? Thank you for your comment on the price level. We understand that this is our major healthcare reform direction. Mr. Albert Leung. Thank you, Chairman. Thank you, President, for coming to the Council. We didn't have the President of the previous terms coming to the Council. Doctor costs account for some 40% of the total cost. Has the administration looked into the ratio of doctor costs? Are they comparable to those at other hospitals? I understand that under the existing model, doctors bring their patients to the hospitals and then they charge their patients. We need to convince the public. We need to let them know that CUHK-MC will repay the loan after 3 years. So unnecessary costs will have to be cut. So I'd like to know whether the administration has any response. Will you slash your operating costs? Secretary, I will give the floor to Dr. Feng. Thank you, Mr. Leung, for your question. Well, there is no information for us to make comparisons. The operational model is different. In some private hospitals, doctors bring their own patients to the hospitals, and the cost of these doctors are not calculated in the total cost of a hospital. Now we impose restrictions on the charging of medical services for some private doctors. They need to implement packaged medical services. Therefore, we cannot make direct and simple comparisons. When the IFA prepared for the report, they drew reference from other hospitals and reached the percentage of 41%. Right now, the figure stands at 44%, which is not far away from the projected 41%. We will manage costs. We will strike a balance between quality and efficiency. These are top of mind for us. Mr. Leung, can the administration share with us the approximate cost of doctors? Well, for private hospitals, we don't have such information. In private hospitals, doctors set their own prices, and they are different from the hospital bills. Hospitals may charge the fees for the doctors, but then the fees collected will not go to the account of the hospital. There are in-house doctors in hospitals, and these will go to the account of the hospital. In these cases, the fees charged by doctors will go to the profit and loss account of a hospital. Well, definitely, doctors will charge a price that is sufficient to cover the cost of the medical services. If the efficiency is good enough, the revenue will go to the account of the hospital. Well, probably you can refer to a pilot scheme on the transparent pricing in private hospitals. Mr. Tang, I am sitting on the council of the CUHK, and I was invited to be a board of director of the CUHK-MC. I am an alumnus of the CUHK, and I am a electrical member now. Well, I hope members from the CUHK will feel that we are caring very much about the CUHK, hence our questions. I hope you will feel our concerns. And please relate our concerns and questions to the management of the CUHK and CUHK-MC so they will feel the care and concern of the public. I am absolutely confident in CUHK-MC. I hope members will support it. CUHK has a golden brand. It has a total of 260,000 alumni. It has 10,000 staff members, and the transparent price levels are in line with social interest. In my communication with Dr. Feng, I can tell for sure that CUHK-MC facilitates medical history sharing for patients. Some private hospitals are unwilling to do so, so CUHK-MC is worth our support. Society pins high hopes on the president of CUHK. Now that you are on the board of directors, you are the director. As we learned from the news, Dr. Feng will retire in the middle of this year. I thank Dr. Feng for setting up this hospital. When Dr. Feng retires, will there be major problems for CUHK-MC? How will you deal with succession and development for the hospital? Thank you.
President, thank you, Mr. Tang. Thank you for your questions. Dr. Feng Hong will retire by the end of July this year. We are very grateful for his contribution in the past decade. He has established the MC as well as its operation. In last fall, we are already aware of his retirement. Dr. Feng Hong has notified us. We have kicked off a global engagement initiative. We are also engaging some headhunting companies as well as a search committee. Mr. Professor Lee is the chair of this search committee. As for myself, as Professor Philip Chiu is also a member of this search committee. We are already looking into the application of some high-quality candidates. We will finalize the final candidate very soon. This candidate needs to be highly experienced in operating the hospital, and they also need to have innovative mindset. He needs to convince us with his or her leadership as well. And I have confidence that the future operation of CHKMC is continued to improve. Next, Mr. Lee. Chair, CHKMC is very well branded. It also enjoys many alumni, staff members, etc. We all look forward to seeing it improve. I have a question to the Secretary as well as CHK. I want to ask about your borderline. Well, we have a tight budget at the moment. Well, you are providing service in lieu of interest, but then we are all we're actually receiving fuel income. In terms of your mechanism, well, we have approved the extension period of 2 years, and now you are asking for 3 more years. When the Secretary or CHK see that your performance is deviating from the expectations, at which point will you think of some compensation methods? We cannot predict the reality. Of course, we all hope for the best. But if it is not the case, how do you kick off the mechanism to think of our next steps? I really don't hope to see you again 3 years later. Well, because I can understand that the projected figures cannot be 100% accurate. I came from the same background. I can understand that. But if we do not have that mechanism of mentality, it will not be fair to all taxpayers or the society as a whole. I would like the Secretary or CHK to explain to us under what circumstances or at which point will you kick off your contingency plan? Can you share it with the taxpayers as well? Well, all the figures are provided by CHK, including the operating income and cost and the future estimates. CHK has engaged some professional bodies to run the projections, and they are already providing some reasonable projections. We believe that is reasonable. As for the 2+3 plans, well, at the beginning, we have already proposed that it takes us 5 years to repay the loans. So it is not a new proposal. It is just an extension of our previous proposal. We are just completing what we have already proposed. We are repaying the interest in the form of services. This is us trying to utilize our facilities and to support the public healthcare sector. In the future, the interest will constitute of up to 100,000 patient bed, and it can help shorten the waiting time of those in the public sector. As for when will we start considering alternative measures? Since CHKMC have adjusted their estimates, after discussing with them, we are aware that they are already putting up with some contingency plan, including financing methods. By 2027 or 28, if they are still unable to achieve cash flows that enable them to repay the loans, we will kick off the financing measures. I will not give details here. But there are some alternative measures. 3 years later, if they still can't meet the target, actually, we are already discussing about these kind of scenarios. Can we listen from CHK as well? Chair. Thank you for your question. It is something very practical. We explain it in details in the documents. We are certain about the operation model, but we are extending the timeline. Well, because we are talking about a 10 years operation period, we are only able to break even at the later stage of our operation. Further on, we will be able to accumulate sufficient reserve in order to repay the loans. We are actually extending the whole operation model. We are certain about the model, but we are extending the timeline. And the issue is with our cash flow. We are all clear about that. As I have already explained, through its own reserves as well as its donors, CHK has already injected funds of 3 billion Hong Kong dollars to CHKMC. As for the financing measures in the future, we are already making preparations for that, and we will monitor closely its operation. I am confident that we are able to propose a well-accepted proposal in the future if needed. Thank you. Next, Professor Priscilla Leung. Thank you, Chair. I'm also an alumni of CHK. I spent 4 years at CHK. Second, in 2015, I am one of those who approved the establishment of CHKMC. I very much agree that in Hong Kong, we need to have a hospital that is affordable by the general public. We long to see a hospital that is affordable by the middle class in Hong Kong. I hope it's every success. Some of my family members have engaged in the service of CHKMC, and they are a different age group. We experience great attitude from the doctors as well as high quality of services. I would like to recognize that. During the pandemic, you are also working together with the government to offer inpatient beds. This is something that deserves our compliments. But now we are worrying about the continuation of your deficits. Or in terms of voluntary medical insurance, I think you are one of the pioneer in this reform, that is a VHIS. As a private hospital, how can you meet the needs of our healthcare demand? I think it is not just about money. The emergence of Hong Kong Children's Hospitals shows us the importance of doctors. I trust that with the support of the medical faculty of CHK, you will not be short of doctors, because the medical center is already established. I really do not expect that we have to close it in the future. Because of the situation in Hong Kong right now, I only hope that you will do better in the future. People mentioned that the HA is considering to take it over. I would like to hear the views of CHK. I hope that you will be able to operate it on your own. You also mentioned about financing. I know that if you are running a business, you have to seek help from the business sector, but I truly do not want you to operate like those private hospitals, because they are only focusing on the dollar sign. I can truly feel that the atmosphere of CHKMC is different from the other private hospitals. This is something that worth supporting. That's why I support you to extend the repayment period, and I would like to give you sufficient discretion to take care of your future development. There's also one change that I spotted. The president will become the chairman of your board. Do you think it will help CHK to work even closer with CHKFC? Will it be helpful to ease some minds? Because when you came last time, there are many things that you seem not to know. with these new arrangements, are you able to lessen our worries? Please understand that everything that I said is being spoken in support of you. I would like to defer it to Professor Chai. Thank you, Professor Priscilla Long. We truly understand the practicalities of financing. We are certain about our operation model. Please understand that as a private hospital, for any private hospital to break even, it will take at least 10 years. So looking at our projections in the chart, as you can see, it is a new projection, and the timeline is similar to our previous estimates. You have asked about the gap of our previous estimates. Perhaps we were more optimistic back then because the environment was different back then, and now we have accumulated some experience in actual operation. Therefore, the assumptions of making these estimates is likely to be more accurate. Your second question. Well, although the president is very busy, he is willing to accept the offer of the board and become the chairman of the board of directors of CHKMC. It shows huge determination. And surely, it is connecting the governance and the management of both CHK and CHKMC. The success of CHKMC relies on the Faculty of Medicine as well as the doctors there. They need to have a stronger sense of ownership. And that is what I'm going to demonstrate. Previously, I served at PWH since 1997, and I am responsible for a clinical department, and I also take charge of COS. And to a certain extent, our hospital is a startup. Previously, I was the chief of services of PWH. I hope that with our passion and commitment, we can continue to improve our services. Next, Mr. Michael Tian. I have a number of questions. It is surely something positive to have one more high-quality private hospital. In 2023-24, your actual deficit has decreased by 100 million Hong Kong dollars. It is something very positive. However, well, to be frank, you did a terrible job in making estimations in the past. If I give you my support today, then the impression of the general public is that I would accept all your future estimations. Well, by 2037, you will be able to repay all the loans. I need to be able to trust you in all this in order to vote in favor of you. So this is something I have to ask myself. According to the information that you provided today, you will explain how you can go into the black in the coming years, right? So in 2023, according to your estimations, you will have a deficit of 230 million Hong Kong dollars, and previously it was 400 million. And in 2024, it was 150, and now it's 300 million. And now you said that you estimate that by this year, you will be able to reduce it to just a deficit of 54 million. If you can decrease it from 400 to 300 to 54 million, then immediately I will give you my support for a 3-year extension period. But this estimations of a deficit of $54 million is based on the assumption of making income of $23 million in the second half of this year. In order to do that, from 2024 to this year, you need to be improved by 170 million Hong Kong dollars. So it is mid of February. You're telling me that by June, by the first half this year, you will be able to improve by 170 million. It is impossible for you to believe in that. It is ridiculous. Therefore, my estimate is that this year you will not have a deficit of 54 million. My estimation is that you will have a deficit of 100 million Hong Kong dollars. If you compare this with your estimation 2 years ago, it is still a huge gap. Basically, every year you overestimate your income. Based on that, by 2033, I'm sure that you are unable to repay the loans. In 2047, 50 years past, I still don't believe that you can do that. Having said all that, I just want to express one point. I need to be reasonable, right? I want you to consider to extend your application for 6 more months. Come back to us in August and please do better estimations. By August, Secretary, they already have the figures of the second half this year. They said that they can make money of 23 million Hong Kong dollars. Let's see if they are able to do that by August. If they can achieve that, then I have the foundation of trusting their future projections. If not, unfortunately, if I was correct, then they would have a deficit of 500 million to 100 million Hong Kong dollars. Then 6 months later, you have to revise all your future profit proposals so that it will be more down to earth. I'd rather you be open and frank. You can tell me that you can repay the loan only by 2060. I would think that it is reasonable. But if you come to me with such calculations, it will means that I have to accept all your unreasonable future projections. I think it does not work. I am an alumni of MBA. I have been in the retail businesses. I do these kind of calculations on a daily basis. And this is my stand. This is something that I would like to require. Please discuss it again at FC. I don't think they can tell me if they are able to come back by August with a new set of projections. Well, if that is the case, you have to wait until FC. There is a period of time in between. By then, you can tell me if you are willing to do what I proposed, and it will be easier for me to decide at FC. But I am positive. I very much want to see you continue in business, and I can also see a positive momentum. But it is not as well as you have projected. That's it.
Secretary, any brief response? Well, Mr. Makutin has used up his time. I'd still like to reply, though. I understand he doesn't agree much on the projections. The projections were prepared by the CUHK and the medical center. The extension at present will expire on the 18th. If we don't extend the loan repayment period, it will have to repay immediately because of default. The medical center will be taken back in case of default. Just 6 months alone is not enough for a medical center, so we need to decide whether we will grant a 3-year extension repayment period. I hope that we will seek more different options, including financing. Thank you. Mr. Tommy Zhang. Thank you, Chairman. I'll try to be quick. Well, I don't need you to reply to me. I'll just make my points in my 4-minute speech. I am sitting on the council of the CUHK. 2 years ago, they were asking for a 5-year extension period. And I'll be frank with you, I was one of the members who objected to it. I told Professor Chen as well. I didn't want to agree with the 5-year extension period just because of the figures you provided. These figures are simply ballpark figures. What if the medical center still fails to repay the loan? For the 2+3 period, we will review the situation 2 years later. Well, I'd like to convince Mr. Michael Tin to vote in support of the motion in the Finance Committee. 2 years ago, in our discussion about giving a five-year period to the medical center, well, Mr. Michael Tin studied MBA. He's way smarter than I am. How can a medical center which has started operation for 4 years or so to repay the loan? Whether there was COVID or not, it will be difficult for a hospital to do so. The Council of the CUHK has seen a lot of changes in its membership. While the CUHK-MC is a wholly owned subsidiary of CU. As the president said, we need to take ownership of the medical center. I referred a lot of my friends, my relatives to the medical center as well. One of my relatives was actually discharged from the medical center just this morning. There haven't been any complaints against the CUHK Medical Center. None complaints whatsoever. I wouldn't have guessed that Professor Low would be willing to take up the post of the chairman of the CUHK-MC. Professor Low is already very busy. He has a lot on his plate, but then he's still willing to take up the post of the chairman of the medical center. We have a lot of management officials with us today. We need to put our minds together in order to solve the problems facing the medical center. I believe the medical center will do a good job in the financial position. While my party supports the extension of the repayment period, at the Finance Committee we will also vote in support of it. Mr. Duncan Chiu. Thank you, Chairman. I declare that I am a member of the Hospital Authority. First of all, I express my support for the loan repayment period being extended by 3 years. Packaged prices, these are very important enhancement plans of the private healthcare sector. Allowing the sharing of information across e-health is very important as well. Healthcare technology is important as well. Clinical research, technologies, and so on. These are paramount. I'd like to ride on Mr. Tin and Mr. Zheng's point. As Dr. Starry Lee said, I agree with what they say. I read a lot of such statements. Do we need to review these forecasts? Now that the medical center has started operation, it's been in operation for a number of years. In Annex 4, in relation to the projected revenue, $2.8 billion now. Up till 2037, the figure will rise to $8 billion or so. It's not a game. Unlike a game, there are actually caps. After the commissioning of the medical center, there will be caps. We cannot choose which surgeries to perform and which not to perform. So your projections about revenue is actually more than I have expected. Are the projections in line with the facts? You need to take stock of the projections. How much money has spent on clinical work, R&D? These will be pragmatic. So I think we can prepare the projections in due course. There may be changes in the management, so we can conduct a review. Even if we manage to reach $8 billion, many of the costs are variable costs. $7 billion or so are costs. It is important that hospital needs to control the fixed costs in order to break even. There are drug dispensing machines. These are state-of-the-art technologies. Can you share more with us? Secretary, thank you, member. CHAMC started in September 2021. It's been only 3 years and 4 months. This is actually a very short time for a hospital. We removed the mask ban only in March 2023 in the COVID pandemic. We only have reference to figures for 2 years after the pandemic. Some members mention hospital beds, and I agree with members. The projections may not be in line with the reality. Every 3 years, we will come back to the Council to report to members, so we will keep a close watch on the development of CHAMC. Whether Mr. Michael Tin and Mr. Duncan Chiu believe the figures prepared by the medical center, I will ask the medical center to reply. When all beds are used, aside from inflation costs, there won't be any increase. The curve you can see right now has already factored in inflation. I agree with the analysis of Mr. Michael Tin. Of course, the figures 2 years ago were based on the IFA. The projections were prepared by the IFA. university engaged an IFA to give us comments. There were a lot of assumptions. Overall, by the looks of it, not all of the assumptions were correct. Some were not. In the coming few years, there will be a lot of changes, and I believe we need to keep updating the projections. In the second half of this year, we have a rather positive projection because when we replenish the manpower pool, we have some business plans to launch. Say oncology and cardiology, these are specialists areas seeing faster growth. From 9 to 5 to 9 to 8 in the evening, we want to take in more patients. That explains the higher growth in the second half of this year. We'll keep a close watch on the projections in order to make sure they are in line with the reality. There are internal factors as well as external factors, and we'll have to make continuous adjustments to our projections. We'll learn from our experience in order to make adjustments. Thank you.
Mr. Shokafe, we will not allow for the second round. Thank you, Chair. Previously, some member has asked about the financial status this year. They are unable to break even this year, and they estimate that the doctor cost is rather high. Dr. Feng explained that the doctor's cost is high because they are hiring some more senior doctors, and that is how they ensure quality. So my question is, previously when you make the estimations, weren't you already arranging for the hiring of senior doctors? Weren't you expecting to hire some high-quality doctors? What kinds of doctors were you hiring previously, Dr. Feng? Going back to the IFA's report, at that time, they suggest that it will be about 41%. That is, the total cost will take up 41% of the total revenue. I think they are running the estimations according to the existing operation of other private hospitals. But as Secretary Low mentioned, many other private hospitals are relying heavily on visiting doctors, so there is no doctor cost. So how exactly is the doctor cost of those hospitals is an unknown. What Secretary Low mentioned is very accurate, because the revenue is, the cost is also a part of the revenue generating source. All right, understand. My question is, well, you said because you don't have that many numbers of patients, so you will not utilize that many patient beds and you will not hire that many nurses. I agree with you. What is the total number of patient beds that you have and how many are being utilized? And also the utilization rates of your OR. The actual inpatient beds is about 30. How many percent is your total? Our total beds is 516. And we are utilizing 300. Next year, by next month, we will utilize 16 more. Speaking of number of OR, we are operating around 10 OR, including the gynecology OR. We have room for increase. If we have that many number of surgeries, we can increase number of OR. Dr. Feng, you now estimate the maximum number of patient beds. I'm asking about the maximum of estimates, and how many OR do you estimate to utilize and how many are total? Our total inpatient beds is 516 and the number of utilization now is 300. Our total number of OR is 20. Our total number of OR is 25 and now 10 is being utilized. And what is the usage of the 10 existing OR? It is highly utilized. And we are scheduling many surgeries in the evening hours as well. Understand? In other words, there is still much room for you to increase business. If you grow your business, you will have the money to repay the loan. One way to generate revenue is to offer package services. Well, many private hospitals are generating a lot of revenue. They are never unable to repay any loan. One of the ways is to collaborate with other private doctors, and they can just split the cost. Just like the contractors, they will not hire everybody. They will just outsource because they don't have to pay them salaries when there is no business. But if you increase your volume of business, then the cost will be reduced. The labor union will always concerns about the workload of the healthcare staff. But now your concerns is to run short in your business volume. If you're running a business, what you need is to increase your number of partners because they can generate business and generate income. And there's no reason for me to turn you down. And even the secretary is here. I have no choice but to support you. But we also have a deficit budget. So please consider, because you still have a lot of underutilized wards and OR, please think of ways to generate more businesses. We are over time by 51 minutes, so I have to round up this agenda item. Do you support us to submit it to FC? Michael Tian. We are submitting it to FC, right? I want to request for further discussions at FC. Yes, I'm asking if you would like to submit it to FC for further discussion. Do you support it? Any objection? Ministerially, I support to submit it to FC. After listening to all these comments, I would like to ask CUHK to revise the statistics. Please be more realistic. Can we ask CUHK to readjust the statistics? As Secretary Low has mentioned, the figures are provided by CUHK. IFA normally will do the calculations according to the demands of CUHK. Can we ask them to revise the calculations when they come to the FC? I understand. Time is short. They have to come back to FC in March. See if you can adjust your calculations. Mr. Michael Tian. Chair, I would like to clarify. Basically, I support the extension of repayment. I just want them to submit some more reasonable estimations. Not to say that you can fully repay by 2037 or 2047. I will support them no matter what because they have a good momentum. They are already cutting their deficits by hundreds of millions. Well, there are other members who've said that it is meaningless for you to extend it by 6 months. So the way that I'll vote at FC is to ask for a more reasonable projections. I hope that the Secretary can look into it because you repeatedly mentioned that the numbers are only provided by them. I wonder if you can also look into that. At FC, my vote will be determined by the revised sets of projections. If it remains unchanged, if I am unable to see if they are able to have a difference of 170 million in the coming 6 months year on year. If I can't see that, then you're just forcing me to object to you. As I mentioned, the figures are provided by CHK and MC. We have looked into it. We are also in close touch with them. We discuss with them in order to have a more realistic set of numbers. So this is a finalized set of figures. If this panel would like to have further statistics from CHK and MC, then it is up to them. Because we need to concern about the time constraints. Mr. Chang, I have a quick response. I completely understand what Michael Tian has mentioned. At the board of director, well, although I'm not sitting at the board of director of the MC, but in the past 4 to 5 months, we have spent many hours looking into the calculations. At the one meeting, we spent 2 hours just to go through these numbers. It is quite difficult for us to revise a completely new set of numbers within 2 weeks. I think it is a meeting of FC by the 28th of February. It's not by 18th of March. So we're just talking about a week or two. I hope that you can have confidence in the board of directors. We are all very committed in order to do it well. As you can see, even the president volunteered to become the chair of the board. Well, if the deadline is the 28th of February, we are unable to prepare a set of documents that can accurately reflect our future projections of our financial status. I'm very grateful for Mr. Michael Chen. You said that you will support us even if we are only able to repay all the loans by 2037 or 2047. You and I are alumni. We hold similar views. That is what I expected as well. But it is not the time for us to expect how much we can repay by then. What you're requesting is to have another set of numbers by the 28th of February. Perhaps next year, when the secretary returns to the panel to report, you will be able to see a set of more accurate numbers. As for now, I hope that you can have more confidence in the board. At least give them 1 more year. Give the president 1 more year. He has just come to his office. It takes time for him to look into the numbers. But we are one-hearted. We're also having a new CEO. No one knows who that is. I think we haven't hired that person yet. I hope that you can give us some more confidence. If we cannot approve it in the FC meeting this month, if we have to devote it, it will be very troublesome because there's nothing for us to look into. I would like to ask for your support. 2 years ago, members questioned me about the change of attitude before and after these 2 years' time. And my change of attitude is because of my connection with the board of directors. I can see how committed they are. They are truly putting effort into it. They are not just relying on the board of directors alone. I hope that you can understand. This is a big worry of mine in the past 8 to 10 years. But today, I want to ask you to have some faith in us. It doesn't take long. By next year, when we discuss this item again at the panel of health services, you will be able to see some more realistic numbers. I want to ask for you to just vote for us at the FC this month. I can see that most of you support us to submit it to FC. This is the end of this agenda item. I think we can't continue any longer on this item. The secretary said that it is meaningless for us to defer it for 6 more months, right? Mr. Tian, we have to discuss it at FC. You also said that there will be a new budget, but then I will be forced to not support it. So you either consider extending it for 1 year. First of all, thank you, administration and the representatives from CHK and MC.
大家意見我哋
Will we extend our meeting to discuss the next discussion item? Dr. Starry Lee? Well, just now members have expressed that there would be great concerns over the next discussion item. If we need to extend this meeting, I am afraid that we do not have sufficient time. Well, Chairman, can you discuss with the Secretary how we should handle it? It's already 12:45 right now. Ms. Rebecca Chen. Have we already extended the meeting? Yes. Yes, I'd like to echo what Dr. Starry Lee said. We have the House Committee meeting at 2:30. The administration submitted the papers too late. And in the first discussion item, a lot of members already spoke on it. For the cluster adjustment, there would be a lot of members who would like to speak. If we still extend the meeting until 1:30, I don't think we will be able to finish the discussion of this item. Ms. Judy Chan? Am I coming through? Please switch on the mic for Ms. Judy Chan. I'd like to echo what Dr. Starry Lee said. Just now, we spent 2 hours discussing the discussion item of the CUHK. The next agenda item is close to the heart of society as well, and I believe we need 2 hours or so to discuss the next agenda item, and we don't have sufficient time. We only have 10 odd hours to read the paper. The papers were only made available to us last night, so I support Dr. Starry Lee's suggestion. Mr. Tzit-yuen? Well, I don't need the mic. Mr. Tzit-yuen? All right. I agree with Dr. Starry Lee. I was supposed to have an important meeting. I'm not a member of this panel, but because of the gravity of this agenda item, which is close to the heart of many members of the public, I didn't attend that meeting, and I made it to this meeting instead. I believe I'll have a lot to say in the next agenda item. Will you extend the meeting by 1 hour, 2 hours? I believe we should reschedule the discussion of the next agenda item. Only then will it be fairer to our members. Professor Priscilla Leung, I'm grateful to you, Chairman, first of all. Thank you for recognizing the concerns of society on the Hong Kong Children's Hospital. We were supposed to discuss this agenda item. I can't wait to discuss this item. We shouldn't wait until the next regular meeting. The whole society is very much concerned about the next agenda item. Even those who are not members of the panel on health services attend this meeting as well. Should we hold a special meeting to discuss this agenda item? Many people are concerned about the shortage of doctors in the city. We have a good hospital right now, so how can we help the hospital to stay afloat? We shouldn't drag our feet. Professor Chen Kong, I agree with Dr. Starry Lee. I expect the discussion will be long for this agenda item. We have been asking for a long time for the discussion papers, but we only received the papers at 7 or 8 o'clock last night, so I agree with rescheduling this agenda item discussion. Well, the Hong Kong clusters cover Sai-Ying-pun, Taiwan, and so on. There are only 2 paragraphs covering the 7 clusters in Hong Kong. It didn't mention the Hong Kong West cluster. I believe we need more information. So I hope Chairman will allow us to discuss this agenda item at the next meeting. Mr. Edward Leung, I agree with Dr. Starry Lee. The Hong Kong East cluster is concerned about this discussion item. If we have too little time, it will not be sufficient for us to reflect the views in society. Dr. Starry Lee, thank you. I thank all members for echoing my views. Well, what I meant was that you need to discuss with the Secretary. Members understand. Many members are concerned about this agenda item. We need to steer the middle course. If we directly put back this agenda item, then the next meeting will become very long. I don't agree with delaying this agenda item to the next regular meeting directly. If need be, we can hold a special meeting to discuss this agenda item. Secretary, any response? We discussed 2 agenda items today because a lot of members are concerned about healthcare issues. We have a consensus that we discuss 3 agenda items in a regular meeting. That's why we only put 2 agenda items in the meeting today. We have a total of 43 hospitals in all the clusters in Hong Kong. So how much time do we need to spend? There are many items in relation to healthcare reforms. That's why we insist on discussing 3 items at each regular meeting. We still have a lot of items that we want to discuss with members. There will be a knock-on effect if we directly delay the discussion of this agenda item. We have prepared a lot of items to discuss with members, so probably we need to add more sessions for our panel meetings. That's what I think. Mr. Michael Tin, I agree with holding a special meeting. Thank you. If we hold a special meeting, is it possible, Secretary? Yes. Then we will discuss with the administration the date of a special hearing or a special meeting. Then, next agenda item, any other business? No AOB? Thank you. Thank you, members. We'll inform members if there is a special meeting. Thank you.